The common medications used in geriatric nursing. When we say geriatric nursing, we mean adult nursing, like people that are 65 and over. Let's make it easy and simple to understand. Let's jump in. If you are a nurse or a student nurse, a newly qualified nurse, or somebody thinking going into nursing, this video will help you so much. These are common medications that geriatric nursing. Let's go. Number one, older people with memory loss or dementia. That's very common with age. People that are older, 65 and over, most of the time, some of them are dealing with dementia, or even if they've not had diagnosis, some of them have memory loss. And these are the kind of medication that you see them commonly use. Donepezil is one of the medication that's commonly used, especially here in the UK. Let me just tie the video down to the UK so I don't have to generalize. But in the UK, these are the kind of medication you always see with older people with memory issues. Donepezil is one of them. Memantine is another one as well for people with memory problem or people that have diagnosis of dementia. Number two is heart and blood pressure medications. One of them is amlodipine, which is used for lowering blood pressure. The next one is metoprolol, which also helps to lower blood pressure and heart rate. And furosemide helps to reduce or get rid of extra fluids, because a lot of the time people have heart conditions. Some of them, their heart is weak, they have cardiovascular issues, their heart is not pumping as it's supposed to do, and as a result they will start retaining fluids. Furosemide helps to get rid of excess fluids. Number three is bone health medication. Again, older people have bone problems because as we age, our bones become very, very fragile. To keep their bones strong and to prevent fractures, these are some of the medications that are commonly used. Calcium and vitamin D, and also alendronic acid as well. So alendronic acid mainly is to treat osteoporosis, very common with old age. Number four is diabetic medication. As well, as people age, sometimes, especially type 2 diabetes, people begin to develop type 2 diabetes because of lifestyle, weight issues, and other health conditions that would lead to diabetes as well. Metformin is the first choice of medication, and the next one is insulin. These are the common ones as well for diabetes. Pain medication as well. Pain is also another thing that older people have to deal with consistently, because as we age, again, different issues causing pain. Our movement become very, very reduced. People sit down for a long time or lying down for a long time, makes their body very rigid, and as a result, pain. And sometimes just as a result of other health conditions as well, so many other factors. Pain is always an issue. Paracetamol, you always see old people having paracetamol, is always the first choice of medication. But then you see some of them, if paracetamol is not solving their medication, their pain issues, then you see cocodamol, codeine, and all sorts of pain medication. But paracetamol is widely used, and most old people are constantly on paracetamol. Unless otherwise paracetamol is not doing the job, then GP or their doctor can look into that to prescribe another different medication. Sleep and anxiety medication, that's another thing. A lot of older people as well, dementia can cause sleeplessness, sometimes because some are dealing with pain, and a lot of things. Dementia causes anxiety as well. A lot of them struggle with sleep, and they will be dealing with anxiety as well. Melatonin is the first choice that's always used in the geriatric nursing, which helps them to sleep. Lorazepam as well is another medication that's commonly used. You see them using for anxiety as well. When they're anxious, they are just, restless and all that. Lorazepam is a choice for anxiety. But another side effect with lorazepam is it causes drowsiness and can increase their risk of fall, which is why it is very important when you're giving all this medication, you know the side effects of this medication as well, as to make sure that you are monitoring them, you are not treating one and causing another problem. Medication that you also see with geriatrics or in geriatric nursing is blood thinners. Blood thinners are also very, very important, again, due to so many other health factors. People that had stroke before or something similar to that, they need to be on blood thinners to prevent stroke from happening again, or other health conditions. Aspirin is the first choice. Then you have warfarin is also another choice that's always used in geriatric nursing, and also apixaban. You see a lot of older people on that medication. It's a blood thinning medication. Safety tips that you need to know while you are looking after the elderly people. Like I said, they are very frail. They are very frail. When you give medication, you need to know how to monitor side effects to make sure that you are not causing any further harm to them, or the medication that is meant to solve one problem is not causing another problem. And all the side effects that you need to monitor mostly are dizziness, confusion, because most of the time when they are confused, we relate it to their age, probably maybe because they've got dementia, but that's not always the case. Sometimes it's side effects of certain drugs, especially when they are on a new medication. You really need to monitor and make sure that the side effect is not affecting the resident or the patient too much. Falls are also side effects of so many other medications. You give them one medication to prevent anxiety, or you help them to sleep, but because they've got dementia, they've taken that medication, next minute they will have a fall, they will have a fracture. You are treating one thing or taking care of one thing and leaving the other. It's important to monitor the side effects. You also need to watch for drug interactions, because most of the time older people are always on so many types of medication, because you will see one person is having kidney disease, cardiovascular disease, dementia, hypertension, like I said, so many other illnesses, and because of that they are taking different medication for all those different conditions that they have. We need to watch out for all those medication interaction as well. These are the common medication used in geriatric nursing. Knowing what to do and how to use them safely is key to great care. With that, guys, we come to the end of today's episode. Feel free to like, comment, and share. Let me know your thoughts in the comment section. And if you haven't subscribed yet, please subscribe for more nursing content like this. And I will see you guys again soon. Bye.